Hey, this is Brian from Davis Foot Orthotic Solutions. Welcome to our web series, Insights from the Speaker. Today's guest is Dr. Joseph Hayes. Dr. Hayes is a physical therapist who is board certified in orthopedics from the American Physical Therapy Association. He received his undergraduate degree from the University of Pennsylvania, a master's in physical therapy from Touro College here on Long Island in New York, and a doctorate of physical therapy from Massachusetts General Hospital's Institute of Health Professions. Dr. Hayes is a clinical assistant professor at Touro College here in Bayshore, New York, and the owner of Comprehensive Physical Therapy in Commack, New York. He has lectured extensively on various topics of orthopedic physical therapy and will be presenting a course for Davis Foot Orthotic Solutions here in St. James on Tuesday, May 12th, 2015. The course is entitled Clinical Update on the Management of Subacromial Impingement Syndrome and Adhesive Capsulitis. Welcome, Joe. It's a pleasure to have you here in our studio.
Hey Brian, it's great to be here with you today.
Okay, so let's get started. So Joe, tell me a little bit about your career as a physical therapist.
Well, my career, Brian, has changed over the years, and I graduated from Touro College in 1991 with a master's degree in physical therapy. My first job out of school was at Columbia Presbyterian Medical Center, and I actually worked in the cardiopulmonary department and the acute neuro department. I thought I always wanted to work in orthopedics, but I really thought it was smart to start in a hospital and get some good background exposure before I started treating patients in the outpatient setting. Then after about a year or so at Columbia, I went on and worked as a staff physical therapist in the outpatient setting, where I eventually became a partner, and then in 1999 became the owner.
Oh, okay. So but you were also teaching as well.
Well, in 1993, I was lucky enough to be invited to be a teaching assistant in a therapeutic exercise course. And I immediately identified with the teaching. I enjoyed the teaching. And then I was fortunate enough in 1995 to be offered a full-time faculty position. And since I've been teaching kinesiology, musculoskeletal physical therapy, therapeutic exercise, as well as introduction to physical therapy examination courses.
That's great. So let me ask you, so you're doing a lot of orthopedics. I mean, is your practice mainly orthopedics at this point in time?
I would say my practice is about 95% orthopedic patients. We see some patients with neurologic disorders, whether it be Parkinson's or balance things, but for the most part it's orthopedics.
Okay, so what's brought your interest into orthopedics? Like, why do you like so much about it?
You know, typically it started like a lot of PTs do. I was playing college sports, I hurt myself, had a surgery, needed physical therapy, and I really had some terrific people taking care of me, and I thought, this is something I could do. So I really wanted to work in orthopedics. I took the classes in school, I was taking kinesiology, I was taking the orthopedics class, and I said, this is really something I'd like to do. But as I mentioned before, I thought it was important that I would work in the hospital setting, get some good experience, and I'm really thankful for that experience. I felt like when I graduated from, or stopped working in the inpatient setting, and I was working with some sick people, if I could take care of them, I could take care of anybody who walked through my clinic door. And it really, you know, that background in physical therapy in the acute setting really helped me.
It certainly does. I mean, it just gives you the knowledge, the background, for picking up things that some other people may not pick up in an outpatient clinic.
Absolutely.
And it's really important.
You know, we see patients after total hips or total knees or shoulder surgeries, and I know what they've been through the whole time. You know, if they're admitted to the hospital, they go to subacute, and then maybe they get to me in the outpatient setting. I had a good idea of what they've been going through, as opposed to if I've always worked in the outpatient setting, I really don't know what they've been through.
All right, so now let's talk about the course that's coming up for Davis Foot Orthotics, May 12th. It's going to be here in St. James. So you're talking about two shoulder pathologies. Can you tell our viewers what to expect? What's going to be in this course?
Sure. So the course is really going to concentrate on the two pathologies of adhesive capsulitis and subacromial impingement syndrome. Two very common orthopedic shoulder diagnoses seen in the outpatient setting. There's been some research that shows up to 20% of people who are attending physical therapy are coming for their shoulder. So I thought it was important that we try to reach out to everyone and make sure they have the most up-to-date information on these two common pathologies. I remember going to PT school and I learned about subacromial crowding, and I learned about acromial morphology as it relates to subacromial impingement syndrome. I learned about capsular inflammation, and we learned about capsular pattern as it relates to adhesive capsulitis. but our understanding about these two shoulder pathologies over the last several years has exploded.
Really?
So I think it's important, and my goal is in the course to update all healthcare providers who are taking care of people with shoulder pain on how to take care of these two common shoulder pathologies.
Very cool. So who do you think should attend this course? It should, from what areas of practice and professions?
Well, I can see that this course would be applicable to almost any healthcare provider taking care of someone who has shoulder pain, whether it be a physical therapist assistant, occupational therapist, coders, athletic trainers, anyone who's taking care of someone who's having shoulder pain, and be it subacromial impingement or adhesive capsulitis, would benefit from the things we hope to teach in this class.
Yeah. Well, I'll tell you, I've gotten a lot of calls from people in the subacute arena that are very interested in this course.
Oh, super.
And outpatients, so it looks like it's going to be a pretty good night, busy night for you. And
well, I hope so. And we're excited to bring this new information to the table, whether it be everything from the diagnosis, the management, the medical management of these common diagnoses, and how we can take care of them as therapists.
Well, I'm certainly looking forward to that. Well, thank you, Joe. Thank you for coming here and taking busy time in your busy schedule to come and speak with us.
It's my pleasure to come, and I really look forward to seeing everyone on May 12th.
All right. Thank you.
Thank you, Brian.
Okay. So there you have it, folks. Another edition of Insights from the Speaker from Dr. Joseph Hayes. So don't forget, the course is May 12th, 2015. It's a Tuesday. It's in the evening from 7 to 9 p.m. here in St. James, New York. Plenty of seats available, and we hope to see you there. It's going to be a great course. He's going to bring a lot of new literature into the topics of subacromial impingement syndrome and adhesive capsulitis, so to make you a better clinician. All right, so we'll see you again, and we'll see you with the course, and stay tuned for another episode of Insights from the Speakers from Davis Foot Orthotic Solutions. Take care.